When should firefighters use load and go, or stay and play patient care? Imagine you're on the scene of a fire or accident, and a patient needs help fast. Deciding how to care for them can make all the difference. Firefighters often face this split-second choice. Do they stay and provide more treatment on scene, or load the patient into the ambulance and go straight to the hospital? This decision hinges on several key factors. If the patient has a life-threatening injury like severe bleeding, unconsciousness, or a suspected head or spinal injury, the priority is getting them to advanced medical care quickly. In these cases, load and go is the best approach. It means packaging the patient swiftly and transporting them with minimal on-scene treatment. Every minute counts, especially if the injury might worsen or if the scene isn't safe. For example, if there's a fire or hazardous environment, delaying transport could put everyone at risk. On the other hand, stay and play is used when the patient's condition is unstable but not immediately life-threatening. Here, firefighters or emergency medical service providers provide more extensive care on scene. This might include securing the airway, controlling bleeding, or administering medications. If the scene is safe and the patient needs stabilization to improve their chances of survival, this approach makes sense. For instance, a patient with a cardiac arrest might benefit from advanced life support on scene before moving. The decision also depends on available resources. If the ambulance has advanced equipment or personnel, they might choose to stay and stabilize. If the scene is dangerous or the patient's condition is critical, quick transport becomes the priority. Firefighters assess the scene for hazards, evaluate the patient's condition, and work with EMS teams to choose the best plan. Sometimes, they help with basic life support like CPR or bleeding control while preparing the patient for transport. Ultimately, the goal is to give the patient the best chance at recovery while keeping everyone safe. Firefighters need to be trained to make these calls fast and accurately, considering the severity of injuries, scene safety, and available resources. Knowing when to stay and treat or when to load and go can save lives and improve outcomes in rescue operations.